My name is Cornelia Borowczak and I live in Germany. I have 2 children and the life of our family changed completely as the younger one of my children was diagnosed with chronic myeloid leukemia in 2013 at the age of 12.
My name is Westerweel and I'm a hematologist from the Albert Schweitzer Hospital in Dordrecht, the Netherlands.
What is CML and why do people develop the disease?
So CML is a cancer of the white blood cells, and it's caused by a chromosome shift in one of the stem cells in the bone marrow. So inside the bone marrow there's one cell in which 2 chromosomes have got interchanged, and that causes that cell to keep on dividing and eventually accumulate in a larger number of white blood cells in the blood and bone marrow.
Which medical tests are needed in order to diagnose CML?
So to diagnose CML, we need to look at blood and bone marrow, and that's to establish the diagnosis, but also to establish if the disease is in chronic phase or in advanced or even blast phase. That's done by microscopy, so we look at the blood and we look at the bone marrow under the microscope. But we'd also do specific tests to see if we can detect the Philadelphia chromosome in the bone marrow, and if we can detect the BCR-ABL product using a test called PCR, polymerase chain reaction. Sometimes we'll also make an ultrasound of the spleen because we want to know the spleen size at diagnosis. And we'll run some general tests looking at the renal function and the liver function, those sorts of things.
Once a patient is diagnosed with CML, how is treatment likely to proceed?
So the majority of patients with CML present in chronic phase. And chronic phase CML can be treated using tablets, oral drugs. These tablets are called tyrosine kinase inhibitors, and there are 5 different varieties on the market currently. And these drugs, they stop the leukemia from dividing leukemia cells. And within a few months, you'll see that the white blood cells go down and disappear from the blood. In patients who are receiving tyrosine kinase inhibitors, when they respond well and the disease has disappeared from the blood, which we call being in remission, then the life expectancy is very good. When the leukemia has reached really low levels of remission, then eventually the life expectancy will become similar to that from the general population.
Most patients start treatment taking a medication called TKI. Can all patients expect a response to the medication?
The greater majority of patients respond well to their first choice of TKI, whichever that is. But some patients either do not respond optimally, so we check that. So we check using blood tests for the BCR-ABL to see if the BCR-ABL goes down in a way that we think it will eventually lead to a durable control of the disease. And sometimes when that's not the case, we need to switch therapy. In other cases, we do not switch because the response is not optimal, but because patients experience side effects that continue to be present, and that may be a reason that we need to switch therapy. Because we have 5 TKIs available currently, the greater majority of patients will either respond and tolerate their first choice of therapy or one of the alternative drugs after switching.
Do CML patients need medication for the rest of their life?
So when we developed the TKI drugs, we thought that if patients responded well, they would always need to take the drugs for the rest of their lives. Because the TKI drugs don't actively kill leukemia cells. They just switch off the signal which makes them divide more. So the number of cells will go down, but there will always be some cells still remaining in the body. However, in the last few years, we've discovered that some patients may actually discontinue their TKI drugs, even though there are leukemia cells still detectable. That was something which came as a surprise to us also. There were some individual patients who needed to stop therapy, for example, because of pregnancy or serious side effects. But even though sometimes there were still leukemia cells detectable, they did not expand again. So they remained in a small number, and the patient would remain in remission without TKI drugs. So after those observations, there have been several large clinical trials investigating discontinuing your TKI drugs. And what we're seeing now is that a proportion of patients are able to stop their drugs while remaining in remission. And that's something we call treatment-free remission, TFR, currently. It's important to realize that the majority of patients cannot try and discontinue their TKI drugs. When we look at a recent cohort in the Netherlands, we saw that after 6 years, slightly more than 30% of patients met the criteria for being able to try and discontinue their TKI therapy. So the majority of patients is likely to need to continue their drugs, perhaps indefinitely, but we do have to say that there's a lot of development in clinical trials to see if we can offer options to eventually stop drug therapy also in those other patients.
Is life expectancy restricted in CML patients?
When CML presents in chronic phase, the prognosis is really, really good. The chance of achieving a durable remission, the suppression of the leukemia, is very high with the drugs that we have currently available. And that makes that life expectancy approaches that of the general population for the majority of patients. So that means that your length of life will be the same as if you didn't have CML. It's different for patients who present or develop accelerated or blast phase disease. In those cases, the prognosis is not as favorable, and it requires much more intensive treatment, usually involving chemotherapy and stem cell transplantation. But in patients with chronic phase CML who are in remission, when they're using their drugs, they lead a normal life. Even though there may be some minor side effects, people with CML who are in durable remission using their TKI therapy, they may go to school, get an education, go to work, have children, like a person without CML will be able to do.
And what side effects of treatment might clinicians see in CML patients?
So the tyrosine kinase inhibitors have been developed to target specifically that CML protein, BCR-ABL. Unfortunately, there are also effects on other proteins, and that can cause quite a wide variety of side effects in patients. Fortunately, most of the side effects are not very serious, but they can be very burdensome for patients. For example, chronic fatigue, gastrointestinal complaints, skin changes, and also some elevations in blood tests for example, the liver or the pancreas.
Should patients follow the doctor advice and take medication, even if they experience side effects like bone pain or muscle pain or cramps?
Taking your drugs regularly, the way that it's prescribed, therapy adherence, is crucial for successful therapy in CML. That's actually been documented really well in scientific studies also. Patients who miss more than 10% of their dosages are very unlikely to achieve a major molecular response to MMR. And that's required for sustainable control of the disease and eventually the optimal life expectancy. So if side effects occur, then it's very important to discuss it with your doctor and not to let that interfere with your therapy adherence. So either some action needs to be taken to alleviate those side effects, or it could be an option to maybe switch therapy. In any case, therapy adherence should not be hindered.
How can caregivers be best prepared to make the most of the time of the patient with the doctor?
When I see a patient, it always helps if the patient is well prepared so that the patient has had the opportunity to have me address all the questions that he or she has. I think caregivers can play a very important role in that. Even though, of course, caregivers also have their emotions, sometimes it's difficult for the patient to express their emotions, but also get all the information across that they want to bring across to the doctor. I think caregivers can play a very important role in that. But what's been your experience in doctor's visits? What has been your role?
You don't want to know it. As I told you, my son is the only child with CML in our hospital, and the doctors changed every month. And I often had the experience they never heard about CML. And now we have the situation, if we come to the hospital, the physician asks me, what have we to do today?
Right. Yeah. So you've become like an expert in the disease.
A little bit.
Yeah, no, that makes sense. Maybe you've also stood up for your son to say to the physician, wait, this is what I think you should do.
I will give you an example. After 3 years of treatment, our doctor changed. And our first appointment, our new doctor said, my son should have a bone marrow biopsy again, because the last one was longer than 1.5 years. And I know my son is very well responding to the therapy, and he doesn't need more bone marrow biopsies. And so I said, no, I think he don't need one. And we had a big discussion about this.
I think that helps if you're the caregiver, because if you're the patient, him or herself, and you criticize something that the doctor suggests, that may be difficult in a doctor-patient relationship. But being a caregiver, particularly a mother, I think it's more natural maybe to pose those critical questions. Yeah, I think that's really good.
From your experience, what other important roles do caregivers play to support CML patients?
I think patient support is very important. CML is a chronic disease, which in essence is incurable with the drugs that we are giving to our patients. And patients face major challenges, psychological challenges of coping with a chronic incurable disease. Even though the survival is very good, you do need to take your tablets every day. Therapy adherence is essential. And as we spoke about earlier, those tablets do come with some side effects. So dealing with the psychology of the disease, dealing with the burden of side effects and hospital visits, I think it's very important that the patient is not alone. And I think caregivers can play a very important role in that. A good social structure helps the patient and also helps to achieve an effective treatment. But you're a caregiver yourself. What's your experience? What has been your role in supporting your son who has CML?
I know CML is a very rare disease, and it's uncommon in children under the age of 18. And my son is the only child in our hospital. And so from the beginning, I want to know everything about CML to support him and do the best to give him all the help he needs. So I think it's very important to be a well-educated patient and a well-educated mother. Yeah. If you have a child with a disease.
I think it's true not only for pediatric CML, not just CML in children. If we look at the number of new CML patients also in the adult age, it's very low. So it really helps if patients come together, and I think caregivers play an important role in that. Did you meet with other caregivers?
Yes, I do. As my son was diagnosed with CML, I started to search for information on the internet, and I found some patient organizations in Germany. There's one organization called Parents Organization for Children with CML, and we have an internet platform called Leukemia Online. And I got in touch with them, and I became a lot of information about CML. In Germany, we have a parents organization for children with CML.
Oh, really? Wow.
Yes, we have. And we are organizing yearly meetings for the families. And it's over 2 days, 2 or 3 days. And we have a clinician there who gives the newest information for the parents. And during the time, the parents learning about CML, the children and teenagers do some activities together, and
Wow.
it's a very nice meeting. And over the year we have telephone conferences monthly.
We have the same in the Netherlands. We also created, together with a patient advocacy group and hematologists, an online platform called See My Life. And it actually has an area for patients, but also an area for caregivers. For caregivers to get their information, but also to share experiences in a forum for caregivers. And I think that highlights the importance of caregivers, and I do think it's great if there's a good support of the patient.
Yes, it's very helpful in the beginning to get in touch with other patients or well-educated patients to learn how to live with the disease and what can we do to make the best with the new situation.
I think it's a great development that caregivers are given more attention. I think caregivers are very important in the support of their patient, not just psychological support, but also support in the patient as taking control of the disease and being a partner with the doctor for an optimal outcome. And I think it's also important that we've learned that caregivers are also getting support, that they're meeting at patient advocacy meetings, that they're getting information about the disease, becoming a little bit of an expert in the disease, and meeting either in person or online with other caregivers. I think that's a great development.
As a caregiver, you are not alone. There's a lot of information and support available.